the person who came with you with the trouble. No, like usually, biomental examination, and during the biomental examination, we can find tenderness, the fixed uterus because of formation of the adhesions, trouble with the Douglas sponge, enlargement of the ovaries. But of course, it's not enough for us. Huh? We need to use some methods of investigation. And that investigation will be in accordance with our plan. Take a look. You can find here, imagine. Yes, we can use ultrasound examination, but first and the main that we need to do, we need to find seeds of endometriosis. We need to see it. How can we do it? With help of methods of visualization. Laparoscopy, cystoscopy, hysteroscopy, histopathological examination. We can take biopsy. No, sometimes we can find increasing of the special marker like CA, but it's not on non-specific, and in other markers like IL8 or CR. No, we don't use it in the practice. That is why main type of our diagnosis, a main way for our diagnostic process is laparoscopic view. See and treat, objectivization, that's the main moment for management of endometriosis. And laparoscopy is the gold standard. We can find it like a brown, black, or white spots at the surface of peritoneum. And if you have history of endometriosis, typical period for endometriosis, and laparoscopic picture, only at that case you can be ensured that that person has endometriosis. Now take a look for that typical picture one more time. Spots of endometriosis at the surface of the peritoneum. Differential diagnosis should be between different disorders, but no, guys, it's just for your understanding. Sometimes it could be endometrioid cyst or non-endometrioid cyst. That is why we need to think about what type of cyst that person has. PID can formate serious pain syndrome, but it's not such prolonged clinical way for PID. Such rare meeting disorders like tuberculosis, ovarian cancer, metastasis. No, if female will be with the such signs like hematuria, acute abdominal pain, of course, we need to exclude all reasons for acute abdomen. Fibroids, typical pathogenesis for fibroids, typical age for fibroids, but ultrasound picture can show correct diagnosis to you. If female with myoma of the uterus. Ovarian endometriosis is the big part of endometriosis because very easy to find ovarian endometriosis in case if female has big stage of endometriosis. We have with you such story. Sorry. Classification for ovarian endometriosis. What like that? You can find it. Stage 1 is just small inclusions. Stage 2, one ovary had the big cyst inside. Stage 3, both ovarian cysts, and stage 4, two sides ovarian cyst more than 6 centimeters. What if you have person with the ovarian endometriosis? It's easy to find that disorder with help of ultrasound examination. Another types of endometriosis without cystic form, very difficult to treat and very difficult to find, because at that case we need to use only laparoscopic picture. And main classification for endometriosis is the classification of the American Society of Gynecologists, means that we need to use our picture for correct stage. One more time, to be clear, guys, we can't find the stage of endometriosis until the moment when we have with you laparoscopic picture. Only with help of laparoscopy we can find the final diagnosis, correct diagnosis. We'll take a look, different places, different seats, different stage of the adhesions, and like the result, different points which can get person during our laparoscopy. That is why, one more time, main clinical signs are pain syndrome, very difficult to do investigation until operative treatment, and only with help of laparoscopy we can find correct final diagnosis. That's why very difficult to work with endometriosis, guys, very difficult. And very difficult to treat. We need to put in our mind information that different clinical cases means different way for the treatment. And any moment, any case, we need to think about age, symptoms, stage, and infertility. And infertility will be the first step of our understanding. First, that we need to ask ourselves, in case of female with endometriosis, need we to think about reproductive function and or no? And usually we need to think. Значит, typical story for endometriosis. Intensive stage, surgical removal of all seeds of endometriosis. After that, using the hormones, and only after that, rehabilitation. For the first step, guys, should be serious surgeries with a high enough quality, because we are talking about extra uterine location usually. Could be involving pathological process, intestinal, bowel, bladder, blood vessels, ureter. If we finished our treatment during operation, we need to stop all results of endometriosis with help of hormones. We need to formate iatrogenic menopause for the female, and duration of our hormonal treatment should be not less than 6 months. And only after that we need to think about infertility, guys. Don't forget that we are talking about late beginning of our treatment, because usually females don't want to go for the doctor with the pain during menstruation. What types of drugs we can use? No, pain management, and anti-inflammatory drugs. That's all, guys. That's all, because we have with you seeds of the and growth of endometrial tissue. Only one way to remove it. With help of painkillers, we just can relieve the pain syndrome. That's all that we can do. That's why different management we have for the present day. Sometimes story about infertility is the main story, and sometimes we think that before starting of our treatment we need to think about reproductive function. You can ask me why. Because, guys, during the operation, during removing of the cyst of the endometrioid cyst at the surface of the ovary, we can make a trauma of the ovaries. By the way, endometriosis gonna kill numbers of the follicles inside, and all that stories play a role, and we need to be very careful during our operation, and that is why in vitro fertilization, some doctors tell that should be doing before our operation. Now let me show what kinds of operative treatment we have, because it's very interesting.
Early and accurate diagnosis of endometriosis may improve the quality of life of patients and provide cost-effective and long-lasting treatment. The drawback of performing a laparoscopy for diagnosis derives from the diversity of endometriotic appearances according to the site of the endometriotic lesion. Clinically, endometriosis varies from tiny little endometriotic lesions to large chocolate cysts or invasive endometriosis. It is unclear whether subtle, typical, cystic, or deep endometriosis are one or several diseases. It is critical to investigate the abdominal and pelvic cavity thoroughly. Careful notation should be made of the size, depth, and proximity to other anatomic structures. Dr. Redwine discussed the use of near-contact laparoscopy for better visualization of these lesions. The magnification of the laparoscope and high-definition video monitoring systems are useful in increasing the resolution of lesions. This technique improves endometriosis detection. Near-contact laparoscopy allows for clear visualization of the endometriotic lesions on the uterosacral ligaments, as seen here. 3 considerations when conducting a laparoscopy for endometriosis: peritoneal fluid, peritoneal appearance, location. Peritoneal fluid studies of macrophages, peritoneal fluid lysozyme activity, and endometrial epithelial cells suggest that these are related to infertility. Endometriosis peritoneal fluid can be bloody, serosanguinous, or dark and brown, consistent with old blood. Here is an example of serosanguinous peritoneal fluid. Here is an example of dark brown fluid consistent with old blood. Endometriosis of the peritoneum can have many different appearances. There's the classic black powder burn lesion of endometriosis, red lesions, brown lesions, clear or atypical endometriosis lesions, peritoneal windows, hypervascularity, scarring. Most gynecologists easily recognize powder burn or black lesions as endometriosis, yet non-pigmented or subtle implants that are vesicular, red, white, or peritoneal defects may also be endometriosis. Endometriosis by location. In terms of genital endometriosis, the uterosacral ligaments are the most common sites of endometriosis. Endometriosis can also be seen on the vagina, uterus, fallopian tubes, and ovaries. Extragenital endometriosis is also possible. You can find endometriosis in the GI tract, the urinary tract, superficially on the skin, or on the diaphragm. Here's an example of endometriosis of the vagina. An endometriotic lesion can be seen on the round ligament. Endometriosis above the ureter. Uterine endometriosis. Tubal endometriosis. Superficial endometriosis on the ovary. An endometrioma within the ovary. Endometriosis on the anterior cul-de-sac. Endometriosis on the uterosacral ligament. Posterior cul-de-sac endometriosis. An obliterated posterior cul-de-sac due to severe endometriosis. Another example of an obliterated cul-de-sac due to endometriosis. Bowel adhesions due to endometriosis. Endometriosis on the diaphragm. Cesarean scar endometriosis. Identifying all endometriotic lesions is paramount to optimal resection of endometriosis. The gold standard of diagnosis of endometriosis is laparoscopy with visualization of endometrial deposits on peritoneum and visceral organs. Endometriosis of peritoneal fluid, which is related to infertility, can be bloody, serosanguinous, or dark and brown, consistent with old blood. Endometriosis has multiple appearances, and the lesions may be confused with non-endometriotic lesions. At laparoscopy, a detailed description of the disease should be noted, including the extent, type, and site of the endometriotic lesions.
No, and one more video, guys, for the serious endometriosis. Difficult to understand. We'll take a look at the intestinum, sigmoid part and rectum, and take a look growth inside the wall of the intestine. How to work with that endometriosis if you have only skills in gynecology? Impossible, guys, and it's very difficult. No, depend of the stage of endometriosis. That is why main conclusion that we need to do after the lecture, that all of us need to remember that such small things like pain during menstruation and pain during intercourse can result in the severe stage of endometriosis if you're not gonna treat it in the beginning. And that is why pay your attention for such patients in the future who tell that I have pain during menstruation. It could be signs of the beginning of big troubles. Can be free for today. Thank you for your attention.
Thank you, doctor.